Sarah with Track Shack, and we are talking about postpartum running. For anybody who has no idea what postpartum running is, you probably haven't had a baby.
Yeah.
Because postpartum is after you've had the baby, now you're ready to get started running. So I'm here with my friend, my physical therapist, Kelly Frank from AdventHealth.
Hello.
She is a pelvic health specialist,
Yes.
PT,
Yes.
Physical therapist.
Physical therapist.
So,
Yes.
You're going to tell us what that is, because when I talk to my girlfriends, they had no idea this existed. So
So pelvic health is just a kind of a subspecialty of physical therapy. So we are all doctors of physical therapy that specialize in pelvic health. What that means is that we deal with things that people don't want to talk about, which is like, fecal incontinence, urinary incontinence, leaking, for our postpartum moms, the diastasis recti, pain with sex, constipation. There's a lot of things that we kind of touch on.
So, in terms of, for our audience, our moms that are thinking about getting out there and running, what are the majority of the things that you hear about? Just those specific things that you just mentioned, right?
Yeah. So we deal a lot with the postpartum moms coming in, sometimes with like pelvic girdle pain, coming in with like feelings of heaviness when they're running. So that could be attributed to like a prolapse, urinary incontinence, constipation, and diastasis recti or diastasis recti, which is like separation of your tummy muscles.
So, why would I, what would make me go ahead and give you a call?
Well, I'm hoping just that you're even just pregnant. Like if you're just pregnant, give me a call. If you had a baby yesterday, if you had a baby 2 years ago, if you had a baby a year ago, 10 years ago, and you're having those feelings of heaviness, you're leaking urine, you're leaking feces, you feel like when you bend over or when you go running, like just, I hear it a lot, like everything's falling out. Like that's not okay.
Right.
And pretty much what I tell a lot of my new moms and my friends is just, if you think that, if you ever have to ask the question, like, is this normal? Probably not. It's probably not normal.
Right.
Yeah.
Right. Okay, so I think probably the number one thing people want you to answer, and I think we already talked about this, so I know the answer.
Yeah.
Is that so when can I get back to running?
Yeah, so it depends. I think you and Kirsten last week, like you guys talked so great about it, is just that it depends on everybody. Everybody's individual. And that's how we like to treat everybody is they're an individual. So I don't know what your pregnancy is like. I don't know what your labor and delivery is like. I don't know if you have 1 kid at home, 4 kids at home, you're taking care of your husband, your house, your parents, his parents. You have to kind of give yourself your own time to recover. The American College of Obstetrics and Gynecology says 6 to 8 weeks, which is kind of what we consider like normal healing time. But the thing I hate about that personally is just that you can't consider something to be normal healing when you're breastfeeding, when you're getting sleep every hour and a half, when you're exhausted, when you're taking care of your home, when you're just not giving yourself the nutrition to adequately heal in 6 to 8 weeks. So the likelihood of being able to just like get back out there, in 6 to 8 weeks is kind of, that's an arbitrary number.
Yeah, and there's
so
much pressure. We all are guilty of the what we're doing right now. We're just surfing Instagram, looking at all those postpartum hashtags.
Yeah.
And you see these women and you're like, I need to be there. Yeah. So how do we deal with that? Is it one of those things where I know I went to see you and I've learned so much after having I have a 6-year-old now and a 1-year-old. So what do we do to kind of get past that worry that we need to get started? I know Kirsten, she puts kind of like a number on it. Kirsten over at Baby Boot Camp, we spoke with her about running while pregnant, but she doesn't like the high impact early on. So
I tend to agree with her too, and most of us do. Like I said, it's what you did before. So we kind of mentioned, like, if you are newly postpartum and you're like, oh yeah, like, I'm gonna start training for like the OUC, probably not the best time to start training for that. If you weren't like a runner before, you weren't into whatever activity before, maybe don't just start that right away. Kind of get back to whatever you felt, good about before. So if it was running, okay, we're going to start with walking. We'll kind of progress to jogging. But if in that time you feel that heaviness and like, oh my gosh, like you just leaked through your underwear, or, you went to the bathroom and you noticed there was like a little bit of like poop in your underwear, or like I said, you're running wherever and you're pushing your stroller.
It happens.
Yeah, you're pushing your stroller and you feel like, oh, things are falling out. Again, these are just they're not normal things. And like on any given day, you wouldn't just like, oh, that's okay.
Right, but as women, we're busy doing
Yeah.
the womanly things we do, and
Yeah.
so to take that step back and to go ahead and see a professional about that, that's kind of it's almost asking a lot. I don't even know anything about this offer, right? Like I had never heard of pelvic health physical therapy before I went, and I don't even remember who told me about it. I don't.
Well, what's cool in the state of Florida, so I'm Kelly Frank, and I'm a pelvic health physical therapist, and we can treat you direct access. What that means is that having our doctor of physical therapy, we can look for certain signs to dictate if you are appropriate for our care or if we need to send you on to medical care. And I feel like most postpartum moms are very appropriate for our care because we are going to do a very thorough assessment, checking out the external structures, looking at your hips, looking at your core, and doing that modified gynecological exam where we can actually kind of just assess, the pelvic floor muscles. Because we have muscles in there. And that's something that we kind of forget about, and there's been a baby kind of hanging out, for a good deal of time, pushing on some stuff, like not making your life very comfortable. And so when they come out, not only can we have tearing, they can come out via C-section, but this is where we can kind of get scar tissue, we can get pelvic pain, we can have that incontinence, we can have a lot of things can happen.
So
down here.
I think you said it quickly, and I'm hoping everybody understood. Like for me, the vocabulary was just so new.
Yeah.
I heard the words incontinence from some of my older colleagues or some people that I just was like, what is incontinence? I don't know what you're talking about. And they filled in. So let's just take a second. Incontinence. What I think that is leaking. So I went on a girls running trip this weekend. Girls, I say that loosely. Moms. And here's our stat, right? Here's our little stat. 6 moms running. 2 of the 6 had some sort of peeing or leaking or something. And so, and it was a surprise. A couple, one was like, I did not even expect that to happen. The other was like, that's my new norm. But
right. It's common, but it's not normal. That is, I can't hit that home enough. If you weren't peeing yourself before you had a kid, you probably shouldn't be doing that as a new mom or, an older mom.
Right.
Absolutely.
And so those are the things that, like you said, when you make that appointment to a physical therapist like Kelly, you don't have to get a referral. That's what that direct access means.
That's what that direct access,
which I think to most people in this insurance-laden world of confusion, we are like, okay, first I got to find my primary, but no, you basically just go on and Google AdventHealth and look for pelvic, and I think you're going to answer the phone, right?
Hopefully not. Hopefully I'm busier than that.
No, but you are always there.
I might answer the phone.
She comes to the phone if you need her.
I do.
So.
But just come in, make an appointment. Of course, we want your care provider to be a part of everything, and we're going to loop them in on stuff, but I also want my patients we have to be our own advocates, especially as women, especially as moms. So if we can kind of just be our own advocate, get the care that you need. Usually deductibles are typically met. I can't speak for every insurance, but pelvic health PT is something that is, covered, deductibles pending. I don't know how much
the coverage, all of that.
Co-pays. And the other cool thing is I get to meet her daughter because you bring your kids in. We all love kids. We have kids. We understand you're busy and this is your postpartum time, and why not be breastfeeding, and we'll do some treatment or work on some exercises together.
That was a concern of mine of what am I going to do with childcare while I'm laying on the table getting examined? And it wasn't a thing. I mean, she slept in the carrier next to us, or I think at some point you were holding her. So it's nice to know that it's not as complicated as we make it out to be.
Exactly.
So we talked, not to get too far off, we talked about the vocabulary of incontinence. Now let's roll back to the vocabulary of prolapse. So I'm not sure how much I'm going to share. I might share because I share. Okay. So, I mean, postpartum, I had stitches, which I didn't the second time.
Yes.
I mean, I did the second time and I didn't the first time. And so for me, I wanted to see what was going on in that region. And so I looked and I was surprised. And so then I just started Googling exactly what I saw. And I didn't know the word for it. So,
and Googling can take you down a dark path that you might not want to get down.
It was strange.
But so what a prolapse is basically like any kind of, there's a few internal organs that can essentially kind of prolapse through the vaginal wall. Typically we see either the bladder, which would be called a cystocele, or the rectum, which would be called a rectocele. You don't need to know that, but we can kind of help strengthen the pelvic floor muscles to kind of help hold everything.
She said prolapse through the wall, which still I wouldn't know what that meant. Basically, your muscles are not as strong, and they're starting the bladder or the uterus may start to fall down the vaginal canal.
Exactly.
Okay.
Yeah, exactly.
It's a real thing.
It is.
So,
but don't go down the Google.
And I asked my mom, I was like, Mom, do we have a history of this? And she was like, I don't know. I've never looked at it.
Yeah.
I was like,
But typically, I mean, some of these things are, kind of, if your mom had this or your grandma had this, likely they probably didn't talk to you about this. I doubt they ever mentioned that they are wearing Depends or that they're wearing sanitary napkins. Like, they're probably not talking about this kind of stuff.
So we talked about what it is. Specifically, we were talking about pelvic floor. And then let's just quick re-intro ourselves. So,
go ahead.
Oh, I'm Sarah with Track Shack, and we're talking about postpartum running with
Kelly Frank, AdventHealth Pelvic Physical Therapist.
So
that was good to remember.
Yeah, I know. I saw it on my notes. So the other thing that we wanted to do is give some insight as to, okay, you've identified that some of these things we're talking about apply to you. So now what? We talked about, okay, yes, you can make an appointment, but are there exercises that people can take away from today?
Absolutely. Yeah, I think kind of like my bread and butter exercise is something that we call the pelvic tilt. I think it's helpful not only for
I know, I gotta get ready. Gotta get focused.
I think it's really helpful not only for kind of like co-activation with the pelvic floor muscles, but if we do have some of that tummy separation, which typically most women, when they are due to pop, they're gonna have a little tummy separation. It can kind of work with that as well. So all we're doing is we are just going to rock our pelvis backwards and try to engage that tummy by trying to bring like our belly button into our spines while breathing. I think I told you to breathe like 1,000 times.
I know, I'm real focused.
It's hard. It's hard for people to breathe. And
I think the other thing is that, like, the body awareness of knowing, I mean, I've heard these things in yoga before, like bring your belly button to your spine, but now it's a totally different thought process because I'm doing this to do what? Why am I doing this?
Yeah, so we're doing this to kind of help, one, like kind of close the gap a little if we do end up having some of that diastasis or diastasis recti. But the pelvic floor muscles, they actually have a little bit of like co-activation, meaning they turn on sometimes together with those abdominal muscles. So if we can start kind of getting that, we can start getting that coordination, get that timing going a little bit better, and then the rest of the exercises kind of just trickle down and progress from there.
Okay, so we're going to do it standing, and then we're going to do it laying down, because what did you call that? This is I
call them functional exercises. So, I think it's, if Kegels are appropriate for you, which, asterisk, they're not appropriate for everybody. We might not start with Kegels for you, we might start with down training, but if we are going to start doing this, like, we want to do this in a way that it's functional for you. Like, if you're just leaking while you're sitting, well, that's probably not when I want you to do your Kegels. Like, we have to start doing exercises in different planes. So if we do it standing, same thing. We're just rocking our hips back, and kind of sucking our belly button down into our spine.
I think I've got it.
Yeah? Want to try laying down?
Okay. And this is the true test, right? Because you can see if my...
Yeah, so it's easier to do on a mat as well, because then you can kind of see the back kind of squish down into the mat itself. So I call it kind of like you have a little baby bridge, and you squish it down.
And I feel like in our sessions, you were asked me at some point, maybe even to kind of dig deep and find those pelvic. I don't even know what I'm feeling.
Yeah,
what are those called?
These are your transverse abdominis muscles. So they're just some more core muscles that we do have, and they are kind of easy to find just right there on the inside of the hip bones. And when you kind of activate that again, sometimes we can kind of get that pelvic floor activation as well, which is nice.
How am I doing?
You're doing great.
Thanks.
Okay, what else should we share in terms of some activities or?
Okay. What do you do, the squatty potty?
Okay.
I know you want to go over to
I
it.
do.
Okay, we'll go to the squatty potty.
All right.
So some of our patients, they come in and they have some constipation. I know for me, like my fear after giving birth was the first bowel
Number
movement.
2.
It was terrifying. Like I was so scared. I was in a hospital, so they did not have access to like a squatty potty, but they did have a turned over trash can. So I probably annoyed our cleaning ladies because every single trash can in our room was turned over, and I just kept using that. But they do make things like the squatty potty, turned over trash cans, your child's step stool, little tiny ladders, anything like that.
And this is making it so that a bowel movement's just easier.
A bowel movement's easier. We're elevating the knees a little bit above the hips. You're trying to just relax. Like having a bowel movement should just be a very, it should be a nice moment for you.
Yeah.
You shouldn't be straining, just being able
You
to
get to
breathe.
shut the door,
Yeah.
and you might be able to lock the door,
Maybe, if you're lucky.
and you might be able to do it yourself.
I still hear like my daughter like, "Mommy."
Yeah.
Like it doesn't
Aww.
matter. Yeah. But I don't mind anymore because I know she's okay.
And some of us are doing this with our babies on our laps, which we all know that happens
Yeah.
too. But
Yeah.
at least put your knees up while you're doing it.
Yeah.
It's a
But
nice
it's
little stand for the baby
And this
too.
might be helpful, especially after having, if you do feel like you have that heaviness, like the last thing we want is for our patients with prolapse to be straining. And so if we can avoid straining, we'll, kind of lessen that prolapse, hopefully lessen that incontinence, and you'll be able to run without those feelings.
Yeah,
So
okay.
that'll be good.
So, this is number 2.
Mm-hmm.
What should we do now?
Yeah.
What should we do?
Okay. You want to talk about the belts maybe?
Yeah.
Okay, let's do belts.
Let's do belts.
So one thing I know that when I was running, this is kind of like a pregnancy as well as postpartum, was that I had kind of just pain like in my entire, like we call it like our pelvic girdle. And the only way I can kind of describe it is that you feel like those little toys, like when you like squish them and like the whole giraffe like falls.
Oh, yeah.
Like that's like how I kind of felt. And so sometimes wearing like a little belt, I hope I brought the right size for me. Oh boy. Okay, but the belt can kind of go just below your belt line itself. And it kind of just, if it feels good, then it should feel like a hug.
Okay.
Like it should feel like a little hug. Yeah, and it kind of keeps your pelvic bones just kind of a little bit more squished, a little bit together, so that when you are running, I ran with it.
Oh.
Yeah. Or I even used like if you had like those little like the like gel belts or like a water belt, like and you just like cinch that and then wear it lower.
Okay.
I use that sometimes too.
I've seen that on people, and I always thought they were just wearing it strangely, but...
I mean, they might be, yeah.
Okay.
I don't know if they were. That was what I used it for.
So,
But, yeah.
where do you find these?
Amazon.
Oh. Yeah.
But you can
I've heard
always,
of Amazon.
yeah. But we do have them in our office, so you can always come in, and I can kind of fit you for one, and even just see if it is something that helps, because this would be like a little bit of an investment.
Yeah.
Yeah, but it's great. I like it.
Okay. Did you have any other things you wanted to share before we... I want to...
Yes. So one of the cool things about AdventHealth, like us teaming up with our hospital and the outpatient rehab, is that now, starting November 21st at 6:30 p.m., I'm going to be hosting kind of like a 4th trimester, like Your Body After Baby course, which has been kind of like my passion really since I had my daughter, essentially, 21 months ago?
Yeah, you counted it up.
I was like, is that how old she is? So being able to kind of educate the moms, their partners, their moms, so grandmas, just about all of this kind of stuff and kind of going into it a little bit deeper and answering more questions, just because I think it's something so important that we have access to help after having a baby, and that just so moms know that a lot of the things that you think that are common, like they're definitely not normal. And there's help for that.
So who can come to that class?
So any postpartum moms, any pregnant moms, like I said, this year it'll be November 21st at 6:30 p.m.
And how would somebody find that? Would they go to
on
AdventHealth or
AdventHealth Women Eventbrite page?
Okay.
Mm-hmm.
Okay.
Yeah. And I think it's only $15 for this year, so it's like actually really cheap compared to some of the other courses.
Very nice.
And they have a great speaker.
Yes.
Yeah. So I'm excited.
She's got more to say, just so you guys know.
Oh, like, yeah. I'm like bubbling with all the things I could say right now.
I know. I was like, is there anything else you want to share? And that was a tad bit open-ended, wasn't it?
Yeah. No. Yeah. That's got. Yeah.
No, we are so fortunate. In reality, we're so fortunate to have Kelly here, and for us here at Track Shack, you're right around the block, which is nice for us that live downtown Central Florida. And we have so many resources. As a reminder, a resource that all of you have is trackshack.com. We have all of our events listed, our running clinics. If you have questions or concerns, you can always email us or comment, and please share this post and get the word out. I know that sometimes people are hesitant to talk about the nether regions.
Yeah,
and
that's okay. I talk about it a lot.
I feel
I'm
like
a little
I do
embarrassing at like
too
dinner
now.
parties. Yeah,
but that's
okay.
good. It's good to have a friend like you.
It is. Yeah,
resourceful. And then I'd say maybe the last thing is, ladies, I want to have a personal invite. AdventHealth Lady Track Shack 5K is in February, and if you haven't been to that event, or if you have, it's one of the most amazing events you'll ever go to in terms of healthy women supporting each other. So this is your personal invite if you were looking for one.
Yes.
One more thing, we've got another Facebook Live coming up, plantar fasciitis, next month. So stay tuned. Again, if you have comments, questions, please let us know. Thanks for joining us.
Bye.